Are you getting pushed into a Medicare Advantage plan? In this video, we're going to be talking about the changing market conditions that are leading more and more people to choose Medicare Advantage over original Medicare. I'm your Medicare guy, Ken, and this is, as always, Medicare Explained. Please like and subscribe if you like the video. Medicare Advantage is a private alternative to original Medicare that has been growing at a rapid rate in the last few years. As of 2024, CMS estimates that over 50% of Medicare enrollees are now in Medicare Advantage plans, and this number is projected to rise to 60% by 2030. Insurance carriers have been able to get these enrollment numbers with aggressive marketing campaigns and by often incentivizing brokers and agents with higher commissions for Medicare Advantage enrollments. Further changes to broker commission structures may push even more people into Medicare Advantage in 2025 and beyond. So the first part of this video is Medicare Advantage is often more profitable for all parties. While there is no perfect way to track profitability in the health insurance industry, data has shown that Medicare Advantage plans have the highest gross margins among any type of health insurance. These numbers show Medicare Advantage has consistently been a huge source of revenue and growth for private health insurance companies. Because of these high margins, they have been incentivizing brokers and agents to push Medicare Advantage with higher commission rates in many cases. With few exceptions, the commission a broker receives for enrolling someone in a Medicare Advantage plan is higher than the commission they receive for enrolling someone in a Medicare supplement and Medicare Part D plan. The decision between these two options should always be holistically evaluated based on a Medicare enrollee's health needs, not because insurance carriers and brokers can make more money on one of the options. We at NJ Life and Health have always operated on what is best for our clients, not what will line our pockets the most. But a recent court decision could add even more momentum to Medicare Advantage enrollments. Let's now talk about the Inflation Reduction Act. The Inflation Reduction Act is a massive piece of legislation passed in 2022 that covers many aspects of our federal budget. When it comes to Medicare, it primarily focuses on prescription drug coverage. We have written and made videos about this topic extensively, and for a more fulsome evaluation, read our article, which I'll link below, and I'll also link a couple of videos as well. For a short summary, the Inflation Reduction Act has a multi-year rollout of changes to Medicare Part D, like eliminating the coverage gap or donut hole, allowing Medicare to negotiate prescription drug prices, and allowing enrollees to pay their annual prescription costs in monthly installments. For 2025, the biggest change from the Inflation Reduction Act is putting a $2,000 cap on prescription costs for Part D enrollees. The brunt of these additional costs will be picked up by insurance carriers. Insurance carriers responded by signaling they would significantly increase the premiums of their standalone Medicare Part D plans. Plans that were around $0 to $20 a month could now potentially cost $50 to $70 a month, if not more. CMS responded to these increased premiums by creating a $7 billion premium stabilization program to try to keep these costs lower. Insurance carriers, by and large, still don't believe this is enough. They decided to take it a step further and sued CMS to remove commissions from many standalone Part D plans. Now, how does removing Part D plan commissions affect you and the industry at large? In late August, Centene, a major Medicare insurance carrier that owns multiple insurance outfits, one of the biggest being WellCare, shook the insurance world. They announced that they would no longer be giving commissions for new standalone Part D enrollments and would be removing legacy commissions as well. Simply put, there is no incentive for brokers and agents to sign up people for a Centene Medicare Part D plan or keep them enrolled in the ones they were currently in. A few other insurance carriers have stated similar plans if they weren't already in effect. Medicare Part D commissions were already low, often being a break-even or loss proposition for many independent brokerages like ours, but Medicare Part D is often the most confusing part of Medicare, and a yearly evaluation is necessary to help clients not have surprise prescription costs. Taking the wrong Part D plan can lead to massive expenses and potentially not having vital medications covered. It is a process that almost always requires expert guidance. Moreover, we are entering one of the most confusing years ever for Medicare Part D due to coming changes implemented by the Inflation Reduction Act. A Part D evaluation from a trusted Medicare broker is incredibly valuable to Medicare enrollees, but it currently looks like brokers will in most cases not get paid for providing this service in 2024. Health Agents for America President CEO Ronald Noel has said the consumer deserves to choose a professional if they want, and then the professional deserves to be paid. We shouldn't be asked to work for free. I totally agree. The issue is this will lead many brokers to have to choose between offering a free service that may be best for their client or potentially pushing people into Medicare Advantage to continue to receive commissions. Brokers and agents were already highly incentivized to enroll people into Medicare Advantage plans, and that incentive is only growing. Many agents and brokers will have to lean towards Medicare Advantage just to keep the lights on, which may not be best for their clients. Now, what can you do about all this? The biggest thing you can do is read your annual notice of changes and continue to support your independent Medicare broker. The Fulsome Part D evaluation brokers provide you is incredibly valuable, and know that they work hard to make sure you are protected. So reach out to them, make sure they know that you are still in their corner. We here at NJ Life and Health will always have your best interests at heart, but we also have to keep the business afloat. We'll be updating you with more news as the situation develops. If you'd like to work with a broker that has your best interests at heart, regardless of the commission structures available to them, reach out to the brokers at NJ Life and Health. We are a local, independent, family-owned business that wants to have your back. We have helped thousands of people with their Medicare across over 20 states, and we want to help you as well. Reach out to our office at 848-226-6897 here in Toms River, New Jersey, or visit our website at www.njlifeandhealth.com to schedule your free Medicare education. Now, if you'd like to learn about more Medicare news or just the general Medicare concepts, we have dozens, if not hundreds, of free videos here to help you understand Medicare on your own time. As always, I'm your Medicare guy, Ken. Please like and subscribe if you like this video. Leave us a comment if you have a question or concern about this video, and I will see you in the next one.